today?
Good, how are you?
Doing well. All right, so I'm just going to have you hop up here for me.
Okay.
All right, and my name is Hannah Crimebrink. I'm a first-year PA student. I'll be helping you out today, okay? Can I get your first and last name?
Caitlin Waldo.
All right, and what do you prefer to go by?
Katie's fine.
Katie. All right, nice to meet you, Katie.
Nice to meet you.
All right, so we're going to start with a physical exam today. So I'm just going to have you go ahead and remove your socks and shoes. You can set them to the side,
Okay.
as well as your mask and your top.
Okay.
All right.
Sorry about the mismatched socks.
They look great.
I was in a rush this morning.
All right, so to start, we're just gonna begin with some inspection. So just taking a look at everything. It's gonna feel like I'm staring at you, okay? Because I am.
Okay.
And then after that, we'll do some palpation. Just take a look at everything, okay?
Okay.
All right, so just gonna start by literally staring at you. My apologies. All right. Do you mind just go ahead and lifting those arms up for me? All right. Let me see those elbows. Okay, perfect. Okay. And we're just going to do a little bit of palpation here, and we're just going to be also testing for moisture and texture.
Okay.
We'll do a little bit of hard palpation, just feeling any abnormalities, okay?
Okay.
All right, so we're going to start with your face. And we're testing for temperature. All right, and then we're just going to palpate a little bit, so let me know if you have any pain with this.
Okay.
Nope. Okay. All right, we're going to move on to the arms here. Testing for temperature. And a little bit of palpation. Any pain with this?
Nope.
Okay. Nope. Okay. All right, we're just going to check for some turgor there. All right, we're going to move on to your chest, okay?
Okay.
All right. Does that tickle you a little bit? Sorry about that. All right, and then again, just testing for temperature.
Okay.
And then once again, palpation.
Okay.
Sorry, my hands are probably a little cold.
No worries.
All right, we're gonna move to the back here. All right, and once again. And just testing for that temperature. Okay. And palpation once again. So any pain with any of this, just let me know.
Nope.
Nope. All right, and we are going to check one more type of inspection. We're just going to use a different angle of lighting, so I'm just going to cut the lights real quick.
Okay.
All right. Once again. We're just checking for any contour, any abnormalities here.
Okay.
Go ahead and lift those arms up for me one more time. Put that off. Send it back. There we go. All right. So I'm just gonna move. Actually, I'm not gonna move this out of your way. Go ahead and have it stance for me here. I'm gonna have you face that wall right there. All right. And let's see. So same thing again. We're just gonna go ahead with a little bit of palpation. Just checking for any texture, moisture. All right. And then checking for any temperature change. And any pain with any of this?
Nope.
All right. You can go ahead and step back up here for me.
Okay.
Just have a seat. I'm going to move this out of our way. All right, pull this out here. And just go ahead and take a look at those soles of the feet there. All right, once again, just going to feel here for any abnormalities. All right, and then just checking for temperature. And any pain with any of this. Nope. Nope. All right. And just gonna check in between those toes. Make sure we don't have any lesions or anything in there. All right. And then we're gonna palpate those toenails. So just let me know if you have any pain with any of this, okay?
Okay.
All right. And then one last thing, we're gonna do some adhesion, checking for adhesion. So I'm gonna kind of pull your toenail a little bit, okay?
Mm-hmm. Okay.
Just making sure it doesn't pop off. All right, that concludes our toe exam.
Okay.
I'm just gonna slip that out from under you. I'm gonna wash my hands. We're just gonna start by taking a look at the palms of those hands. Do you wanna go ahead and flip them over for me? No, flip them over, perfect. All right. Taking a look there, and I'm just gonna check in between these spaces here.
Mm-hmm.
Once again, just checking for any lesions, abnormalities. All right, and then go ahead and flip them over. All right, so once again, a little bit of palpation. Just let me know if you have any pain, okay?
Okay.
And we'll check for that adhesion. All right, and we're just gonna test the base of your nail bed, okay? Or sorry, the angle of your nail bed.
Mm-hmm.
So if you'll just do this for me. Actually, yes, just like that. And then go ahead and flip these ones over for me, and I'm gonna do the rest for you.
Mm-hmm.
We're just testing that angle there. All right, and to conclude our physical exam, we're just gonna take a look at that hair. If you wanna go ahead and let it down for me, please.
Uh-huh.
We'll just be taking a look at the coarseness, thickness of the hair, checking for any abnormalities. All right, and just checking that thickness, distribution. All right, and that concludes our exam. Thank you for letting me check you out today.
How are you doing today?
How are you?
Good. I'm gonna go ahead and pull this out for you. You can go ahead and step on up and take a seat. All right. Well, my name is Katie Waldo. I'm one of the first-year PA students here. And what's your name?
I'm Hannah.
Awesome. Hannah's okay?
Yep.
Okay, perfect. So I'm just going to be going ahead and doing a physical exam on you, mainly checking hair, nails, and skin today, okay?
Okay.
Okay, so first I'm going to have you take your mask, your shoes and socks, and your top off just so we can get a better look, okay?
All right.
All right, so I'm just gonna start by taking a look. It's gonna look like I'm staring at you, because I am. So just let me look for just a second, okay? Okay. Right. Good, go ahead and flip your hands over for me. I just wanna see those palms. Good, taking a look back here. Awesome. So I'm just gonna turn off the lights just for a second to see it from a different lighting, okay? All right. All right, so I'm just looking for some contour here, checking for any abnormalities. Good. All right, go ahead and raise those arms up for me. Good. Okay, let me see those elbows. Perfect, you can put those down. Awesome. All right. So now I'm just gonna go ahead and feel your skin, just see if I can feel any abnormalities. I'll be checking your temperature, and then I'll put some pressure on and you just let me know if you have any pain, okay?
Okay.
Okay, so we'll start with your face here. So just check in for any abnormalities with feel. Good, and temperature. Good, okay, now I'm gonna palpate you, let me know if you feel pain, okay? Any pain?
No.
Okay, so I'm gonna do the same thing to your chest, okay? So feeling good, temperature, good. Let me know if you feel anything. Anything? No. Okay, so put your arms out like this. I'm just gonna go ahead and do the same thing to your arms. Just gonna be feeling good, temperature, good. And here's some pressure. Let me know if you have any pain. Good. Anything there? No. Good. Okay, so I'm gonna go ahead and have you stand up. So let me pull this out for you. I'm just gonna take a look at the back of your legs, okay? Okay. All right, while we're here, I'm just gonna do your back too. So feel and temperature. Let me know if you have any pain. Okay. Nope. Okay, good. So same thing, back of the legs. I'm just gonna feel first. Good. Now temperature. All right. Let me know if you have any pain.
Okay. No pain.
Okay, good. I'm gonna try the next leg. Anything there?
Nope, all good.
Awesome. You can go ahead and sit back up. All right. I'm just going to go ahead and pull this out for your legs, okay? All right, and do the same thing on your legs, okay? So feeling first. Good, and temperature. Good, and now palpating. Any pain?
Nope.
Okay, and now here. How about that side?
Nope, all good.
Good. All right, so if you could just put your arms like this for me, I'm just gonna tuck the turner here. Looks good, okay? And while I have you down here, I'm just gonna go ahead and look in between your toes, make sure everything looks okay, okay? Awesome. Good, okay. Putting some pressure on them, let me know if you have pain. Anything with that?
No.
Okay, so now I'm just gonna check for the adherence of your nails, so I'm just gonna give it a little pull, okay? Okay, everything looks good there, so I'm gonna go ahead and push this back in. Just give me 1 second, I'm just gonna get some hand sanitizer, okay? All right, I'm gonna push this in, and I'm gonna go ahead and look at your nails, okay? So, just like that, good. So I'm just gonna look in between. Okay. Good. And same thing, I'm just gonna press, let me know if you have pain. Okay. Anything there? No. Good. So same thing, checking for adherence. I'm gonna pull on your nails a little bit. Okay. Okay. And lastly, I'm just gonna check the angle of your nail bed. So just go like this for me. Okay. Okay. And then now like this. And I'm gonna grab the rest of your fingers, okay? Okay, good. And then if you could just put your feet out straight for me, I'm just gonna check those soles of your feet. Awesome. And lastly, we're just gonna check your hair. So you can go ahead and take that down for me. Okay, so I'm just gonna look through here, make sure everything looks okay. And then we're gonna feel for thickness and make sure everything's evenly distributed, okay? Okay. Awesome. Okay, well that concludes today's exam. So